On the 8th of August this year, I was allocated 1.5 hours worth of fieldwork observation and engagement at the wheelchair basketball organisation Rebound WA. Our presenters introduced themselves as Natasha and Andrew, both exhibiting the personal nature of being 26 years of age and of Caucasian descent. Natasha explained that she used a wheelchair due to her spina bifida diagnosis. We observed the disparity between a classic wheelchair and a modified wheelchair, but noticed court dimensions were unchanged. We proceeded to practice dribbling the basketball with a wheelchair, followed by 2 games. The session concluded with the presenters recollecting their adversities when using a wheelchair. Natasha explained that her desire to seek an OT was hindered due to an experience she had where she prescribed a foam block bed despite complaining about the pain it bore. My feelings and thoughts upon entering the stadium was that I would be shy with the prospect of me in a wheelchair. My shyness diminished during the game once I realised I was in a state of flow, which is the full immersion in an activity. I recall feeling surprised at the proficiency of Natasha and Andrew's basketball skills. Natasha noted that she had a degree in speech pathology, yet worked at a call centre. My initial thought was that it was a case of occupational injustice, but it was in fact a result of Perth's limited job market. On evaluation, the observation was in fact beneficial, as it provided insight on how occupational justice can be achieved. The organisation allows for equitable opportunity to practice basketball, and my preconceived idea that a wheelchair would limit occupational performance were refuted. The students showcased respect towards the presenters, which was enhanced as the session progressed, a trait I understand to be crucial for collaborative practice. On analysis, the purpose of the observation was to explore my own learning, with focus on how this experience may be utilised in preparation for the fieldwork practicum in January 2019. The experience allowed for me to remove any preconceived judgments as an occupational therapist in training. Being in a wheelchair and Natasha's recollection with her OT gave me the capacity to understand both its logistics as well as empathise, respect and issue partnerships with future clients who use a wheelchair. This is deemed client-centred practice. In conclusion, I acknowledge that I was only comfortable because wheelchairs weren't the norm in this context. This is not the case in Australia's cultural sense. In hindsight, I should have been more open-minded, so in the future I will implement an action plan. My action plan would involve showcasing enthusiasm as well as employing the 5 steps to active listening when questioning the presenters, this time without the preconceived judgments.